Hello, everyone. Happy Monday. It is Monday, May 10th. I'm Rendy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to talk to you a little bit about the impact of the COVID-19 pandemic on Mobile County and just give some updates on some recommendations and guidance that's changed slightly, and then talk about our vaccination efforts. So worldwide, we're inching up on 159 million cases of COVID-19 with nearly 3.3 million deaths. With surveillance data, we know that these estimates, these counts are generally an undercounting of cases and deaths. So, if we have 3.3 million deaths worldwide, then we know that there are probably many more than that have died with COVID. In Alabama, it's the number of people diagnosed with COVID-19 among Alabama residents is 531,094, and the number of deaths in Alabama very close to 11,000. So in Mobile County today, we're reporting on 41,026 cases of COVID-19. 8 were reported to us yesterday. Remember, on our new daily report, we provide the 14-day number of cases as they are reported to us, and then we also now in Figure 1B report the 14-day number of cases by infectious date. And that gives us a better understanding about the natural transmission of COVID in our community. So infectious date is specimen collection date, illness onset date. Well, let me back up. Illness onset date, specimen collection date, or date reported to public health, whichever is earliest. So again, that gives you more of an idea how the natural transmission is occurring. So our numbers are still really low. That is really good news. But the number of hospitalizations each day is continuing to creep up a little bit. And if you remember, after we saw that big spike in January and December, it got down as low as 14 or 15 people hospitalized any given day with COVID-19, and that number is now up in the 40s. So this is sort of somewhat expected because hospitalizations lag behind COVID infections. So remember, Easter and spring break, we saw a really steep rise in the number of cases that occurred during the 14 days following Easter and spring break. And now that is contributing to that high number of transmission during those events, during those holidays. Now we're seeing the impact of that with the number of people hospitalized on any given day with COVID-19. So these are people who may be hospitalized for respiratory conditions or for COVID illness, and have been diagnosed with COVID, or they may be in the hospital for other reasons and are tested and found out that they have COVID that is complicating now maybe some other illness. For the biggest majority of people, they're hospitalized with COVID symptoms. So in our updated, expanded report, so again, this is for data ending May 18th, you can see that we still have we saw a spike in the number of cases that occurred the week of April 18th. That was the fallout from Easter and spring break. And now we have seen the numbers much lower than that week over end since we got over that small spike from gatherings that occurred during the holidays. So let this be a lesson or a reminder to us, because Memorial Day is coming up, and the only way we can avoid another spike due to gatherings and transmission that occurs over the Memorial Day holiday is if we're either vaccinated, so a large majority of us are vaccinated, or if those of you that are not vaccinated, avoid gatherings, avoid indoor gatherings, and if you are in small or outdoor gatherings, wear a mask and distance yourself. That's the only way you can protect yourself if you have not elected to get a vaccine. So let's please keep the numbers low so that we can continue giving our hospital system a break. We don't want to contribute start running the numbers up of people who are hospitalized with COVID again. So just a couple other things that we look at. Again, the number of deaths reported to us. If we look at that trend by the death date, then we see very small numbers of deaths that have been occurring. That's really good news. That is another lag measure, so it would not surprise me if we see, the number of deaths reported inch up a little bit, because again, we know that right now we have about 40 to 45 people in the hospital. And so, the success of treatment and support for those people and keeping them, keeping them out of very serious complications of illness, which would require ICU or ventilation and potentially lead to deaths, that's what our hospitals are working hard to do. So, so we'll keep an eye on that number. Interestingly, the number of, the percent of hospital emergency department visits for COVID-like illness and influenza-like illness have been creeping up the last couple of weeks. And we also look at that percent positivity. So this is what you usually hear discussed in the media, and like, what's your percent positive? What's the community transmission? So after a high of 11%, that, last week, the 14 days following Easter and spring break, we are back down to less than 5%. So around 4% positive of all of the laboratory tests. And the important thing is that we are still meeting our testing goals. So that's good. So keep an eye out. We just have a couple of weeks of school left. Right now, we have localized outbreaks. Our new cases per 100,000 persons is, in the red zone, 365 per 100,000 over the last 2 weeks. And the percent positive is increasing. So we're still sort of in the highest area of concern with regard to schools. So I think that is most of the trend data that we're looking at. We're hoping that this week that the state health department will publish data, statewide data. We hope this week they will publish data on breakthrough infections, on reinfections, and on variants that have been detected across the state. We know in Mobile County that we have a very high proportion of COVID positives that are the B117 strain, the so-called UK variant. This is become the predominant variant in most areas of the United States. So hopefully we'll be able to see at least some state-level data to remind people that these variants are out there. I think we've detected maybe 4 different variants in Mobile so far. They're more highly transmissible. Most of them, their characteristics are not so different that they, that the vaccine won't work. You will still get some protection, but there is potentially reduced helpfulness by the current treatments because of some of the mutations of these variants. So again, it's kind of hard to talk about it when I have a vision of what that dashboard might look like when it goes live and you haven't seen it yet. So hopefully there will be some information out there publicly this week on, again, variants, breakthrough infections, and reinfections. And again, not to try to scare anyone, but just to remind you that if you have not been fully vaccinated, the only way you can protect yourself is to avoid gatherings, distance yourself, and continue wearing your face mask. So really important that you continue doing that. All right, quite a bit of news to share. But first, let me address a couple of these questions. Someone asking, how long should someone wait before getting a CT scan or a mammogram after getting vaccinated? And there is no reason to wait. So you could get your CT scan and get vaccinated the same day, or vice versa, get vaccinated and then go and have your mammogram. There's no reason to delay or offset those treatments. Very important. Don't wait to get a vaccine. Please go now to get vaccinated. Also a question, when should a person that had COVID 2 weeks ago wait to get vaccinated? In the very, very beginning, when vaccines were extremely scarce, there was a recommendation to not get vaccinated for at least 90 days after you had COVID, but that was because you would have natural immunity, some, we don't know how much, at least for 90 days, and we wanted that dose of vaccine to go to someone who had absolutely no immunity. But now we have plenty of vaccine. There's plenty of vaccine. So do not wait to get vaccinated after you've had COVID. You just need to make sure that you have isolated for 10 days. And as long as you are asymptomatic, then you can go into a healthcare setting and receive your COVID vaccine. There's no need to wait. We have plenty of vaccine available for anyone 16 and older. And then a question about hospitalizations seem high. And yes, remember, you have transmission. Then 2 to 14 days later, you have infection, and infection leads to illness. And then there usually is 8 to 10 days before illness leads to hospitalization. And then hospitalizations for a week to maybe many months potentially lead to deaths. So that transmission, symptom onset, illness so severe it requires hospitalization, and then deaths, those lag behind one another sort of in a natural progression. All right, so a couple of things to review. Let's see, just a reminder that CDC and the state health department have modified the guidelines for quarantine for people, well, basically exceptions to quarantine, right? So a quarantine is required for persons who are exposed to COVID, and we want them to stay at home while we wait to see if they have been infected and become sick, where they could transmit it to others. So quarantine is usually when we're separating out non-ill people who've been exposed to quarantine. And again, quarantine, the ideal length is 14 days. You can shorten it to 10 days if you've been exposed, but on the 10th day you're asymptomatic and you closely monitor yourself through the full 14-day time period. But the exceptions to quarantine are still two. For people who've tested positive within the last 3 months, they don't have to get quarantined and they should not get tested as long as they're asymptomatic, right? So if you had a natural infection, you will have some protection from the immunity that was developed during your natural infection. And so for those people within 9 months, you don't have to get tested again, you don't have to quarantine. Okay, that has not changed. Here's what has changed. You are accepted from quarantine, or you do not have to quarantine if you are fully vaccinated and you're symptomatic. There used to be a time period attached to this, right? At first it was 90 days, then they said, okay, we're going to extend it to 180 days, and now the Centers for Disease Control and the State Health Department have lifted any time constraint related to an exception to quarantine for fully vaccinated people. That's great news. So again, remember, fully vaccinated means it's been at least 2 weeks after your second of a 2-dose series, or at least 2 weeks past your 1-dose series, and you remain symptomatic. If you are exposed to COVID, you do not have to stay at home for 14 days, as long as you stay asymptomatic. So that is really good news. There are other things that are safe for fully vaccinated people. So CDC updated their guidance on the 27th of April. So again, if you are a fully vaccinated person, then you can start doing many things that you stopped doing because of the pandemic. So you should just kind of consider activities and how COVID is spread, and make some good decisions. So for example, you can participate in outdoor visits. So you can attend small outdoor gatherings or visit outdoor with other fully vaccinated persons and not have to wear a mask or physically distance. You can visit the home of someone who, either they are fully vaccinated or have some of them vaccinated, some of them not, or even if they're not vaccinated, if it's just restricted to a single household. So again, you can gather indoors with other fully vaccinated people without wearing a mask or staying 6 feet apart. This has made us really happy at work, that if we are sitting, in a conference room or in my office, and, everyone who is in the conversation, if they're fully vaccinated, then we can take our masks off and have a conversation or a meeting about work. So this is really good news. Again, can gather indoors at a household where, maybe you're fully vaccinated, but perhaps they are not. That's also allowed. You can go outside in small gatherings without wearing a mask. You want to still avoid crowded venues where there might be a lot of people around who aren't vaccinated. But again, if you're outdoors at a park, or walking across the parking lot to enter the grocery store, those kinds of things, then you when it's just you and you're out in the open, or you're at a outdoor gathering with other fully vaccinated people, then you don't need to wear a mask. If you travel, if you're fully vaccinated and you travel, you don't have to get tested before and after you travel. Still have to wear a mask when you're on a federal conveyance, but you don't have to get tested before and after every time you travel. And again, if you're fully vaccinated, you don't have to quarantine for 14 days if you're exposed to someone with COVID. So just a reminder that Alabama, the current Safer Apart order, will expire on the 31st of May, and the state of emergency will end on July 6th. So that doesn't mean that, all of our precautions can just be tossed to the wind. It just means that we have personal responsibility for protecting ourselves and our families. There won't be any more mandates for staying at home or requiring the wearing of a mask, that sort of thing. So it's up to us. So we have to pull together and try to keep COVID transmission low using those things that we know interrupt transmission, which is vaccination, wearing a mask, and socially distancing. All right, so just a couple more things. We're really excited to announce today that the Alabama National Guard, across the state, this is an initiative in collaboration with the governor and the National Guard and the Alabama Department of Public Health and Jefferson and Mobile County Departments of Health, that National Guards are going to be used to vaccinate throughout the state in underserved and rural counties. And we have a team that have arrived in Mobile. So the National Guard has sent a 10-person team to Mobile County to assist the health department in our vaccination effort. So we have had Major James Stallworth, who's been embedded with us for some time. He is our medical liaison to the Alabama National Guard. And Major Stallworth, as I said, has been sort of flying under the radar, has been embedded with us for a really long time. When he is not with us, he's a nurse practitioner in Baldwin County. So the staff, the National Guard team that are here, are comprised of people from both the Army and the Air Force. And again, their teams like this have been distributed throughout the state, but we're very excited to have a team here to help us with our vaccination efforts. As you've heard before, Dr. Eichhold has said, we want to declare independence by COVID-19 by 4th of July, and the National Guard will be an important part of that effort to try to get at least 70% of our population vaccinated so that we can gain independence from COVID. So you will probably be seeing more and hearing more about the National Guard activities in Mobile County. I think that there may be a press release and maybe some photos sent out later today to talk about that. We're super glad that they're here. All right, so on to vaccine. So deep breath, Randy. All right, starting tomorrow, Tuesday, May 11th, we will begin 5-day-a-week COVID clinics at our Newbern Health Center at 248 Cox Street in Midtown Mobile. This is across the street from USA Children's and Women's Hospitals. So it's at the facility of St. Stephen's Road and Cox Street. Okay. As with all events, you don't need an appointment. It's first come, first serve. Just have to be 16 and over. You don't have to show proof of ID or residency or anything like that, just come get a vaccine. We will have to fill out some paperwork because, again, these vaccines are used under emergency authorization, which requires that you acknowledge that you've received information about that. So at this time, bring your card, your shot card. If you're coming for a second dose, bring your card. If you don't have your card, just be prepared to wait a minute or two or 10 minutes. We'll look you up in the system. But we are offering first and second dose vaccine on this schedule. Monday, Wednesdays, and Fridays, it will be a Pfizer vaccine from 9 to 3:30. So Monday, Wednesday, Fridays, 9 to 3:30 at New Bern for anyone 16 and over. Then on Tuesdays and Thursdays, we will be offering Moderna during the same time, 9 to 3:30. Remember, Moderna is only for 18 and over. So it's really, we're very excited to be opening up 5 days a week starting tomorrow at our New Bern Health Center, 248 Cox Street in Midtown Mobile from 9 a.m. to 3:30 p.m. These are the clinics that we are announcing, and you can go to mchdcares.com and see all of this, so don't worry about writing it down if I'm talking too fast. But our first dose community clinics this week, so on Tuesday, this is tomorrow, we'll have a first dose vaccine event at Citronelle High School on 8200 LeBaron Avenue from 1 to 5. Pfizer vaccine, 16 and older. On Friday, we'll have first dose vaccine available during Art Walk at the Mobile Downtown Alliance Building on 261 Dolphin Street from 4 to 7. This will be a Pfizer vaccine, also 16 and over. And then on Saturday, MCHD will hold will hold a vaccine event at Nova Espresso Coffee Shop at 306 St. Andrew Street from 8 a.m. to 11 a.m. This also will be a Pfizer vaccine. St. Anthony Street. What did I say? Andrew. Okay, sorry. Thank you, Mark. So let me start again on that. On Saturday, MCHD vaccine event at Nova Espresso Coffee Shop, 306 St. Anthony Street from 8 to 11. Again, Pfizer, ages 16 and older. So we do have a couple of second dose events. So again, MCHD Cares if you're unsure, but Friday we'll go back to Blount High School from 2 to 6. On Sunday, we'll be back down to the Mobile Alliance Building from 2 to 4. And this will be for people who got that first dose vaccines from us previously. So let me just remind, if you're coming for a booster, bring your shot card. No appointments. If you do wish to make an appointment, is this public information about calling this? Okay, sorry, I was out for a little bit. I had jury duty and then I had a couple days of leave. So if you wish to make an appointment, if you don't like the walk-in process, MCHD is offering first and second dose Moderna vaccinations through several of our clinics conveniently located around the county. So you can call 251-690-8889 to make an appointment for that event. And remember, all of the information on our vaccine events can be obtained through mchdcares.com or by calling 251-410-MCHD, or that's 410-2643. All right. Any questions? No questions. All right. Great. So everyone, we're only doing updates now on Monday at 2:30. If there's anything groundbreaking or surprising, we'll let you know. Keep your eye on the news this week. We are keeping our fingers crossed that Pfizer will be approved for use in children aged 12 to 15, maybe by the end of the week. So stay tuned for that big announcement from CDC. And if we hear anything that we think we need to let you know, we will do what we normally do, push it out through our outlets and do our best to answer your questions on Facebook and by email as they come up. So have just a great week and stay healthy and safe out there.